Out there in virtual land. I'm Dr. Tom Wright, and and today we're going to talk about COVID, which and how it interplays with lipedema. And today I am so lucky to be able to share my time with Dr. Karen Herbst.
Hi, I'm Karen Herbst. I am an endocrinologist and I specialize in the care of people who have lipedema, Derkham's disease, and other fat disorders. And Tom and I have been doing these videos at least a couple times now, I think, over time. And it's really great to be on with Tom doing this again, especially talking about COVID and how important it is to understand some issues for ladies with lipedema.
Great. So now, one of the biggest questions that we're getting is, do lipedema ladies are they at increased risk for contracting COVID? Dr. Herbst, can you answer that?
Yeah. So Tom, you and I have talked about this, and we've both talked about this with other people, and I really do not think that ladies with lipedema are at greater risk for developing COVID-19. And the reason for that is that ladies with lipedema tend to be relatively healthy. They exercise, they eat properly, and the lipedema tissue, because of its location, it really doesn't confer an increased risk in terms of inflammation on the body. The only problem is if a woman with lipedema gains weight, and she develops obesity on the abdomen and the trunk, then she's at risk for metabolic issues, prediabetes, and that is a chronic condition, and that could put her at increased risk for developing COVID-19.
Yeah, that's a great summary. Obesity seems to be, if secondary obesity seems to be a real risk factor in this, in terms of if you get COVID and contracting complications. So, Karen, what are some of the lab or immune abnormalities that are seen with lipedema?
So we don't see a lot of immune abnormalities in ladies who have lipedema. The only problem is that it's really hard to test for immune dysfunction, and you have to go to specialty labs, and I don't think that in general testing for immune dysfunction is standard of care right now. It's not a lab that we can get through regular labs, usual labs, and it's all, if you get it, it's expensive, and then it's not FDA approved. So when we do look at immune cells in ladies with lipedema, we really don't see much different from normal. However, we do know that there are more macrophages in the tissues of ladies with lipedema, and we also know that the fat cells don't produce the same type of hormones from lipedema tissue as, quote unquote, normal fat tissue. So the hormonal milieu is different. And, what that really means in terms of risk for COVID-19, I really can't say. We can look at labs for inflammation, such as C-reactive protein. That's used very commonly. I'm sure a lot of ladies with lipedema have had C-reactive protein levels checked. Sometimes they can be high, but usually they're low. That they become high when they develop that secondary obesity, as you mentioned, Tom. And then we look at things like ESR, which tells you how heavy your red blood cells are, and the heavier they are, the more junk that they have associated with them, and that junk includes acute phase proteins that come from the liver and antibodies, and that is also a marker of inflammation. And then we have the CH50, which I check on ladies. It's a marker of complement. Complement is part of the inflammatory pathway, but we really don't know what those high levels mean, and so I don't think that is a good lab to be checking right now to see what your risk for COVID-19 is. And Tom, can I ask you, when we're talking about, risk for COVID-19, we mentioned obesity and prediabetes. Can you tell me some of the other high risk categories for development of COVID-19, or what would increase a woman's risk for developing COVID-19?
Well, sure. So other, significant, so CDC has put out a list, and they mention, obviously people with cancer, heart disease, lung disease, diabetes, and then age over 65. And then, the other kind of caveat, those are what the CDC has on their website right now. But we are seeing it also is obesity is over. We're seeing more and more complications in people that are significantly overweight, and so that might be part of the CDC's list in the coming future, and they are updating that every day.
And I read recently that asthma was not a risk factor. Did you see anything about that?
Well, so what this is just, again, what they're seeing is that they thought it would be a very significant risk factor for respiratory compromise in COVID. And they are, it is true, they are seeing asthmatics are having that, but not as severe or not as significant as they thought. And so, yeah. And then, one thing, Karen, I wanted to, this is a great opportunity to talk about how lipedema ladies could tune up their immune systems, and, what sort of things, again, that we would you recommend for our lippy ladies now, and to keep them healthy, especially in this time?
So, of course, the usual, eating a healthy diet. Rainbow colored fruits and vegetables have bioflavonoids, which are anti-inflammatory. Trying to exercise to move fluid out of the legs and to keep muscles healthy and reduce inflammation. There are a couple vitamins that we could discuss. One of them would be vitamin D. So we know that the more fat there is on the body, the lower the vitamin D levels are in the blood. And if vitamin D is taken up by fat, it's really not available to be used by the body. And vitamin D really helps the immune system function. And we know that a lot of ladies who have lipedema have low vitamin D levels. So in order, just an easy way, and it's cheap, is to improve your immune system function, is to make sure that your vitamin D levels are up to snuff. And current recommendations are at least 2,000 units per day for adults. So that would be, and it's readily available at any store, online. And because it is fat soluble, you're gonna get it in an oil. So it comes in a capsule. And you can get different kind of oils, and I would just check that on the label, because you don't want to get soy, because it tends to get rancid faster. So I like the vitamin D and coconut oil.
Oh, great tip. Yeah. I every time I get to talk to you, I learn something new. And so, so one of the things I wanted to talk about was just, and I'm hearing this is this COVID is giving special challenges to our lippy ladies, and first of all, it is a little harder. A lot of gyms are closed, and it's harder to get out and exercise. There is some parks are closed and such, but it's still really important. But one of the challenges also is now, manual lymph drainage and occupational therapy, these sort of things are right now. It's hard, and we're having to adjust our practices. We're doing virtual visits, and we're doing, we're instead of sending people to be fitted for compression, we're having them, measure themselves at home, and those to get again, it's still it's still so important to wear your compression, and a lot of and to keep your that compression wears out, so you need to replace that every 6 months, 6 months to the year. And so
What kind of activities do you think that would you recommend that ladies can do at home? Let's say they don't have exercise equipment. What should they be doing?
Well, that's a great question. So, even the vibration plates they not only help with lymphatic flow, and but they also build muscle. And I think that, walking, treadmill, elliptical, I like elliptical because it's so low impact. And, most people live in a neighborhood they can just walk around. Walking is great. Unfortunately, a lot of community pools are not opening or not going to be opened, and so that's going to be a problem. But in water exercises, which are usually a go-to thing for lipedema ladies, is a little tough right now.
One of the when I went to the ILF meeting last June, oh my goodness, it's been almost a year. Dr. Belgrado from Belgium showed with indocyanine green that if you do the dead cat, that you move lymph very well. And how to do the dead cat is you lie on your back and you put your legs and arms in the air and you shake them. So just shake, 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 shake. And you shake your arms and you shake your legs. So I think doing the dead cat is cheap, easy, quick, and a great way to move lymph fluid.
Okay, so great tip. This is
hope everyone's doing the dead cat.
That's another pearl I'm gonna put in my back pocket. So
the other thing to think about, I did talk about vitamin D, but a lot of ladies with lipedema have hypermobile joints or hypermobile tissue, and that's tissue that's at risk for damage and nicks and dings, and so the body has to repair it all the time. And vitamin C is a great anti-inflammatory. You've probably read about it online, that it's been mentioned as something that may help prevent or treat COVID-19. And the reason is because vitamin C helps repair tissues. So taking at least 1 gram of vitamin C every day would be a really good idea. And the question is, how do you take the vitamin C? So vitamin C doesn't absorb very well. So you either eat a lot of fruits and vegetables that have vitamin C, but you can also get lipophilic vitamin C, and it comes in a little packet with, it's kind of oil-based, it's kind of goopy, and you take a glass that's got some sort of liquid in it, whatever your favorite liquid in it, and you dump it in there, and then you swirl around, you take it down like you would eat an oyster. And it really doesn't have any taste or flavor, and that really helps repair wounds. And I learned about that lipophilic vitamin C from a lady with lipedema who had liposuction surgery, and she took that vitamin C after, and she noticed that her healing was really rapid, and she really healed well. So that would be another way to do it. But you can get vitamin C in all sorts of different ways, like emergency, if you have some of that at home, so you wouldn't have to go out. Lots of people have that. You can get the chewable tablets. Just watch out for the sugar.
One last question I have is, what are your thoughts about zinc? Because we're also hearing that. It obviously also helps skin health and skin repair, and it also might have some antiviral with COVID.
Yeah, I was talking about zinc to Linda Ann Kahn from California, and she believes that zinc is really, really important for keeping the immune system healthy, for preventing infections, and zinc acts as a cofactor for lots of different enzymes in the body, including repair enzymes. So again, it's part of that, you're kind of building up walls against the virus, and so vitamin C and zinc both help with that. So I think that would be a good idea too, and you would just follow package instructions.
Now, here's my little tip. Pumpkin seeds are a great source of zinc. And so are all yeah, and all of the squash, are pretty good zinc sources. So just there's my little pearl for you.
Nice. Thank you, Tom. I really appreciate it. And I hope everyone else appreciates all the pearls that we've shared today, and definitely looking forward to comments from people on this Zoom video.
Well, thank you very much for joining, and this has been great. And everybody, please stay safe and healthy. And yep. And we're sending out our positive thoughts to everybody out there getting through this. Yep. There you go. And so, okay. So I'm going to be signing off.
Okay.
Okay, I'm